How to finally end your fibromyalgia nightmare. Hello, I am Dr. Charles Kelsey. What makes us different? We treat patients neurologically and metabolically. No stone is left unturned to determine the exact cause of your health condition. Neurological treatments based on specific neurological testing. Oxygen therapy. Oxygen is fuel for your brain and nervous system. Your brain and nervous system need two things to survive: fuel and activation. Fuel comes in the form of oxygen and glucose. By using oxygen, we will help you heal faster. By using exercise with oxygen therapy, we can increase firing to the brain. By increasing firing of the brain, we help many chronic conditions. Secondly, brain-based therapy. We use specific brain-based therapy: visual, auditory, and motor stimulation to increase firing of the brain. Vibration therapy. Vibration fires the back part of the brain called the cerebellum. One of the functions of the cerebellum is control of the spinal muscles. We may also use auditory, visual, olfactory, and caloric stimulation to increase firing of your brain. Flexion distraction therapy. This creates a negative disc pressure and helps to remove pressure off of the nerve. It also provides a slow stretch of the muscles, which fires up the spinal cord to increase firing of the brain. Metabolic treatments based on specific lab panels. We use specific blood tests such as a thyroid panel, a complete metabolic panel, a lipid panel, and a CBC, which is a complete blood chemistry. We can assess your thyroid, adrenal, blood, and gut function. All can be affected with chronic health conditions. By addressing any problems with your thyroid, adrenal glands, blood chemistry, or gut function, we can help you to heal faster. The complete metabolic panel allows us to check your blood glucose levels, since glucose and oxygen are needed by the brain to function properly. Adrenal stress index. We can further test your adrenal glands with a test called the adrenal stress index. Your adrenal glands are your stress organs, meaning that they react to stress. If you have been or are currently under stress, this test is a must. If you suffer from insomnia, this test will measure your cortisol levels. When your body's cortisol levels are abnormal, you will suffer from insomnia. Cortisol levels can be corrected with specific nutritional protocols, thereby curing your insomnia. We may test to see if you have an autoimmune disease. An autoimmune disease is where your immune system attacks a particular area of the body. So we test for specific antibodies to determine if you suffer from an autoimmune condition. Tissue antibodies. We can check for gluten antibodies, tissue antibodies to myelin, the fatty sheath around the nerves of cerebellar antibodies. The cerebellum is the back part of the brain controlling balance, coordinated movement, and spinal muscles. H. pylori. We can run a test for H. pylori bacteria to determine any problems related to the gut function. Neurotransmitters. We test for decreased brain neurotransmitters. Neurotransmitters are vital for proper brain function. Decreased neurotransmitters can cause increased pain. Hormone panels. We can check hormone panels to determine if the patient suffers from low testosterone in males or low estrogen progesterone levels in females. Symptoms related to decreased hormone levels may include depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and decreased physical stamina. Inflammation. Finally, we may need to test for inflammation in your system by testing homocysteine levels and C-reactive protein. Many patients suffering from chronic health conditions suffer from inflammatory processes. Just about every fibromyalgia patient that we have treated suffers from some form of chronic inflammatory process. Once we have run the necessary test to determine your specific condition, we can successfully treat you with proper neurological and all-natural nutritional protocols. Again, I am Dr. Charles L. Kelsey, chiropractic physician. Out of 60,000 chiropractors nationwide, we are two of only a few implementing the innovative and effective protocols used by Dr. Michael L. Johnson, board-certified chiropractic neurologist. We are part of this group which has successfully treated thousands of fibromyalgia patients over the past 12 years. Will you be our next success story?
My name's Shane Owens, and I'd come in for irregular heartbeat. My heartbeat was in the 160s, and I'd seen cardiologists and on and on and on. They give me MRIs and medication, and everything never helped. My heart rate was still the same, but it made me real tired and no energy. So I started seeing Dr. Kelsey for that probably a month or so ago, and as of today I'm doing real good. My heartbeat's back in the 80s and getting my energy back, and I'm off the medication, and so this does work.
My name is Myris. When I first started coming here, I had real bad lower back pain and bad neck pain, and after coming for approximately 6 months I started feeling much better, and now today I'm just here on a monthly get together to just kind of readjust things, but it's really made an awesome improvement in my life.
Hi, my name is John Gibson, and I started coming back here in March 20th of 2010, and today is June 28th of 2010. I had a motorcycle accident, and part of my side effects were migraines, constant neck pain, and I had numbness in my back. The migraines were every day, and I decided to come try out the doctors, and 3 months later I have no more daily pain. I have feeling back in my back, and the headaches are gone for the first time in 6 months. So I feel good, and I'm ready to take on the world again. And I highly suggest anybody watching this to give it a try, because it does work. So thank you very much.
Hi, my name's Debbie King, and I started coming to Dr. Kelsey a few weeks ago. And when I came, in the middle of my back, it was just like a big knot, and it really hurt really bad. And since then, that pains went away, and we're working on some other things. And I believe with the treatments that she has me on, we're going to see a lot of improvement within the next months. And I'm really pleased with coming here and very impressed.
Hi, my name is Ann Overholser. I came to see Dr. Kelsey in May 8th of 2008. When I first got here, I had complications with an ankle and 2 pinched nerves in my back, which was caused from a fall. I have fibromyalgia, and Dr. Kelsey adjusted me, and I'm able to walk normal now because of it. And my fibromyalgia I've had since '93, and the complications I had was in my feet, hands, and ankle, and my back. And since I've come in for adjustments for the past 2 years, I am now in remission because I eat healthy. I watch my beef and pork, 1 helping a week, and I eat a lot of vegetables, fish, and turkey. At my job, I do very well. I'm able to cope and do everything normal, and I do a lot of exercise, and I keep very busy. And that is the secret behind having fibromyalgia, is taking good care of yourself and seeing your medical doctor when you need to. I have seen my doctor, and he has cleared me and said I'm in remission, and my fibromyalgia is much better since I've been seeing a chiropractor. Thank you.